Your nurse will instruct you when to use emergency medications. Always start with clean hands and a clean work surface. Everything you need will be in this anaphylaxis kit provided by Chartwell. You will start by opening it on the perforated line, opening the brown bag inside, and taking out all of the contents. You will need the baggie with the pills, the baggie with the alcohol wipes, and the baggie labeled IM epinephrine. Everything else we put aside. You will start by opening the IM epinephrine bag and take one item of each. So that is a syringe, the black labeled safety needle, the brown filtered needle with the brown label, and the vial, one vial of epinephrine. You will start by preparing the syringe. So you will open the syringe from this end and be careful not to touch the tip. Next, the filter needle. You will open holding the packaging and careful not to touch the tip and insert the syringe. Next, you will prepare the ampule. You will take an alcohol wipe, cleanse the outside of the neck. You notice there's a white line around the ampule, around the middle of the neck at the hourglass. That is where you're going to break it. But first you need to get all the medication out of the top chamber. So you will swirl it. And if there's anything left, you may need to tap it. You will put your thumbs where that line is, and you will use the alcohol wipe to protect your fingers, and you will snap it away from you to open it. Next, you will take the syringe and take the cap off, and you may need to hold the needle onto the syringe when you do that. You will insert the needle into the ampule on an angle and pull back the plunger to withdraw all the medication into the syringe. The filtered needle will make sure no glass particles will enter the syringe, and you need to be careful not to pull the plunger out of the syringe. You can recap the needle. You will flick the syringe to get all the air bubbles out, and then you will push on the plunger to take any air out. Next, you will take the needle off, and then you will use the safety needle with the black label to inject your medication. What you will do is you will take another alcohol wipe, and you will want to give it on your outer mid-thigh. So you will squeeze your muscle on the outer mid-thigh, rub it with alcohol, and you will give the injection straight into your leg. You do not want to go on an angle, you want to go straight in. I will demonstrate on this. So you will cleanse the site with alcohol. You will take your needle, you will inject it just about all the way in, a little bit can be sticking out, and then you will push down on the plunger slow and steady. And then when you remove it, just rub it with the alcohol wipe. You will take the safety needle and push so you can't get jabbed. Next, you will take the 2 sets of pills. You will take the Benadryl that is labeled diphenhydramine, and then you will take the Tylenol that is labeled acetaminophen. Next, you will call 911 if you have not done that already. You will place the empty packets into one bag so the doctor will know what you took. You will put the ampule containers in here so the doctor will know what medication you gave yourself. You will take the needles and syringes and put them in here as well so the hospital can dispose of them properly. And then you will take this with you or give it to your EMT. You do not want to drive yourself to the emergency department, but if you have someone that can drive you, that will be okay as well.